With respect to the exam, final exam and the spotter in the afternoon, these kind of X-rays a DM or DNB nephrology student might get. Go through the X-ray. Suppose if a student is from a particular institute where femoral perma cath is not placed routinely, this X-ray might create confusion to them. Why? Because usually you might have seen dialysis catheter coming from above and going towards the heart. Look at this X-ray. This is coming from this side and the tip is somewhat here. So what is this one? From the lower side it is coming up. What is this? The tip is here. It is femoral perma cath. It is femoral perma cath. It is one of the procedure being used in the difficult vascular access patient. What is difficult vascular access? If in a maintenance hemodialysis patient, if fistula could not be made, or after making the fistula it failed for some or other reason, in the neck vein, if we are not able to place the dialysis catheter, so what is the option left? To access the bigger vessel through the femoral root or directly placing it in the inferior vena cava, that is translumbar perma cath. Translumbar perma cath also will be having the root similar to this, but looking at the course which is coming from below, most common diagnosis at this point of time is femoral perma cath. On the background, the question might be asked, why not simple dialysis catheter in the femoral? And the other issue is, if simple femoral catheter or non-tunneled catheter is having issue of DVT, why not this catheter? So that you have to answer in the exam. These femoral perma cath are of usually 100 centimeter in length. 100 centimeter, as we take the perma cath, the length will be calculated from the cuff to the tip. It is not the entire length, it is from the cuff to the tip. The cuff to the tip might be 100 centimeter. So that from the femoral through the inferior vena cava, it reaches the heart. That is the right atrium. Student might be having doubt in the beginning of their DM career, why not in the IVC? Why only in the heart? Because IVC itself is a bigger vessel. The issue is the patients are on chronic dialysis, so the longevity of the catheter have to be for a longer period. So what will happen if the catheter is staying in a particular blood vessel? Let us take as IVC. During the dialysis, there will be suction pressure from the sides of the catheter. Suction pressure will be coming from the sides of the catheter. So what will happen? It will be keep on sticking in, coming out, sticking in, coming out. There is a probability of the vessel wall being damaged. So whenever the vessel wall is damaged, there is a chances the vessel wall going for injury. Subsequently, it is leading to the thrombosis. So the longevity is at bit query. Suppose if it is directly placed in the right atrium like this, the suctioning effect won't be there, because in the right atrium the huge amount of blood will be there for the blood flow to occur at even 300 ml per hour, 300 ml per minute or 350 ml per minute. Whatever the dialysis blood flow we want during dialysis can be achieved without that suctioning effect and the subsequent damage to the vessel wall. That won't happen. So that is why the tip is being kept in the right atrium through the IVC. And why not the risk of DVT? Compared to a non-tunneled catheter, the perma cath, this catheter's material is somewhat superior, so that the chances of thrombus generation is being reduced. The material of the catheter is of bit superior quality than the simple catheter, so the longevity is assured. The vessel damage which occur if it is in the particular vessel, and the suctioning effect can be minimized if it is in the heart. So this is related to this particular X-ray. The X-ray is femoral perma cath, where the perma cath are the tunneled subcutaneous catheter placed in the femoral vein. So the catheter is coming from below and it is reaching the right atrium. Okay. Follow-up question, as I discussed, you have to answer it. And the question might be asked few related to the translumbar perma cath. When to place when all the vascular access are exhausted, there is one option: directly access the inferior vena cava through the lumbar root. Okay, that is one another vascular access in difficult vascular access patient. So be prepared for your final exam with these kind of x-rays, these femoral perma cath kind of x-rays. Bye bye.